My name is Victoria Wang from Snohomish, Washington. In my research, I learned that Washingtonians need more access to affordable healthcare, as a survey revealed that 62% of adults experienced at least one healthcare affordability burden in the past year, and 81% of respondents expressing concern over the future of healthcare. What plans does this committee have to improve healthcare affordability without compromising quality of care?
Well, thank you for the question. And your question is an excellent one. How do you increase access to care, reduce costs to health care, and make sure you do it in such a way that you don't jeopardize patient safety? As the chair of the House Healthcare and Wellness Committee, we have heard several bills this session. Probably about just shy of 100 bills were introduced to this committee this session alone. And I think each policy does require us to have considerable contemplation and thought placed into that. I'll provide a couple of examples. One, there might be a specific policy introduced that requires the legislature to consider an adjustment in a scope of practice for a provider. We've had that for folks in the dental industry, in the oral hygiene industry, optometry, ophthalmology, EMTs, paramedics. Each year, the legislature considers those kinds of things, and we take very seriously those patient safety considerations into account, because there is an argument to be made if someone with a credential has the authority to provide to the full scope of their practice. It could increase access to care. But at the same time, people on the other side of the issue will always bring forward patient safety considerations that we need to take into account. So those are some of the policies that we consider every year. The other thing that we consider are insurance mandates. So this year we talked about requiring insurance carriers to provide a second prosthetic for people so they have the ability to go out and run and swim and enjoy the world around them, that people who don't need to rely on prosthetics, we pretty much take that for granted. That is an increased access to care, but there is a cost to the healthcare system overall. So I guess to answer your question broadly, is everything that we do affects the cost of healthcare. Everything that we do increases access to healthcare, or at least the things that we consider. And it's about finding that balance between access, cost, and patient safety. So we consider each policy question very thoughtfully and individually. And sometimes it takes several legislative sessions for a proposal to move through the process onto the governor's desk and to be implemented. But I want to acknowledge the fact that, yes, Washingtonians do pay quite a bit for health care. There are cost burdens that need to be addressed. And I think that nobody disagrees with my philosophy that we need to increase access and lower costs. It just basically comes down to, how do you get there? How do you implement these policies? How do you do it in such a way that's thoughtful, that we are very considerate for the trade-offs when there are trade-offs, and in healthcare, in many instances, there are trade-offs. But at the end of the day, we want people to live happy and healthy in the state of Washington. Until we bring down those healthcare costs and increase access, people are going to have a hard time doing that in this state. They're going to be struggling to do that. So thank you again for the question.
Well, thank you for the question. Healthcare affordability is certainly a concern most people have. And I can't speak as far as what the whole committee is planning to do about it. I'm only one member and a freshman. But for myself, the biggest issues that I see revolve largely around underlying costs that have risen sharply, largely as a result of excessive regulations. We certainly need robust regulations to protect people against harmful practices, but many of our regulations have very little benefit for the cost that it incurs. And so it's something I've been tasking hospital CEOs and doctors and nurses and other healthcare providers that meet with me to look for those regulations that they feel are providing small benefits and a significant cost, so we can try to reform that. Every year, we're adding more regulations, in even this very session, and a lot of them are warranted. Sometimes we do need more. We need to look at the ones we put in the past so we don't sink the system. Liability is another challenge that's increased cost of healthcare. A lot of countries with lower cost of healthcare have liability reforms for the medical malpractice. And again, we need people to be accountable and to treat their patients well, but some of that's out of control. And then yet another challenge is that, for particularly in rural areas like my district, is that Medicaid doesn't pay as much as it costs most of the time to provide the service. And so when you have a rural area with a higher poverty level and higher numbers of the people on Medicaid, it really makes it hard for these healthcare systems to stay afloat. Many providers refuse to see patients who are on Medicaid because it doesn't cover their costs, and therefore access to the healthcare is impaired. And so those are things that I think that we really need to look at addressing.